Good afternoon. Welcome back to Passion World Talk Radio, a wholly owned subsidiary of Global Media Network, LLC. Educate, enlighten, entertain. And this afternoon, on this episode of Lest We Forget Historical, we're talking about fires and older people, or people who are put into assisted living facilities to be taken care of and have 24-hour nursing, or just to have somebody there to help them to make sure they don't fall, or if they need help in remembering to take care of their medication. Recently, there was a fire in Massachusetts where several people were killed and a lot more were injured. However, this wasn't the first time that there was a fire at an assisted living facility. Last year in 2024, an assisted living facility in New York was also had a fire where some of their residents were burned to death and there were a lot of injuries due to the fire. And for your information, there are federal regulations to help you, your family, and the victims in the assisted living buildings or apartments or homes, whatever you want to call it, buildings that regulate what you can and cannot do to avoid having fires. Now, the fire from last year, they never did, and they're still investigating. And the one that recently happened, for example, 4 hours ago, well, they're still investigating that as well. So the article I found was from McKnight's Senior Living. And it was written by Lois, Lois Bowers. And principally, what they do is they released recommendations when this happens. So the name of the article is Federal Agency Releases Recommendations After Fatal Assisted Living Fire. And it was recently released last year, December 17th, 2024. But it's still relevant. You should know a new 71-page report stemming from a federal investigation of a fatal assisted living community has recommendations for a fire department, departments, and municipalities that could affect senior living communities, which is good to know because I live in a senior community. One expert says that the publication of the report offers an opportunity for providers to review the best practices. A resident and a volunteer firefighter died in the March 2021 fire at the 200-bed, and I won't give the name of the home, for adults in Spring Valley, New York. In addition to the fatalities, 2 firefighters and several residents were injured in the incident and the fire, resulting in a total loss of the structure. They said that 2 rabbis later admitted in recklessly using an illegal blowtorch to clean the building's kitchen as part of a pre-Passover practice to make the commercial kitchen kosher for the religious holiday. And yes, they made a plea deal. They were sentenced to probation. The new report and the accompanying summary slides for the Center for Disease Control and Prevention's National Institute for Occupational Safety and Health Firefighter Fatality Investigation and Prevention Program, released December 9th, note that the building's fire alarm system was not online to the county dispatch center at the time of the fire. And additionally, as the investigator said, the building lacked a fire sprinkler system throughout the facility. The report contains several steps that the fire departments and municipalities should take to prevent similar incidents. But at least some of those steps could affect senior living operators too. For example, the report states, have an operational procedure when cultural cleansing ceremonies with live fire are performed inside a structure or facilities. Ensure that the facilities have operational procedures when the facility's fire alarm system cannot transmit an alarm to a designated fire alarm monitoring service. And the report goes on to say, develop a pre-incident plan for high-risk occupancies, including low-frequency / high-risk scenes such as assisted living facilities that is supported by national standards. The issuance of the report provided an opportunity to review the best practices, one expert told McKnight Senior Living. This is a perfect storm scene where just about everything went wrong. A former deputy fire chief and fire marshal who is president of the national consulting firm Fire and Life Sciences Incorporated, based in Mesa, Arizona. To lessen the likelihood that other operators will experience fire incidents, he recommended that providers establish a fire watch policy, have contingencies in place for when hot work, such as soldering, welding, or ceremonial cleansing of a kitchen, is planned, and then the usual fire protection systems might be shut down and forge a transparent partnership with the local fire department. The main element is that you can't underestimate the critical significance and importance of the fire protection systems, particularly the sprinkler system. Skilled nursing facilities must comply with the NFPA, National Fire Protection Association, 101 Fire Safety Code, and corresponding codes for fire alarm systems and fire sprinkler systems. There already are provisions in place that whenever a system is compromised and incapable of sending a signal or performing their function, facilities are required to go on a fire watch, which means that someone will walk the building in regular interviews, and their only responsibility is to be on the lookout for fire and subsequently report it. No such federal requirements exist for assisted living communities, however, said CSTEC, who is a consultant to the Arizona Healthcare Association, the Utah Healthcare Association, the California Association of Health Facilities, the American Assisted Living Nurses Association, the National Association of Healthcare Assistants, and several senior living providers. And at the state level, where assisted living primarily is regulated, states don't have consistent fire watch policies that are the same as the CMS, which is Centers for Medicare and Medicaid Services policies, and that's because most states defer to local jurisdictions, he said. So it's whatever the local codes are, and if they do have NFPA codes enforced and adopted, then there may be requirements for a fire watch, but that's not consistent jurisdiction to jurisdiction. So the best practices, he said, is assisting living communities should have fire watch policy that indicates that when fire protection system, the fire alarm, the hood system, the sprinkler system are compromised, then alternate system must be in place. But besides a fire watch policy, he said, anytime there is a hot work occurring in the building, there needs to be a heightened awareness and contingencies in place. Operators should consider the risk and then divide provisions to make sure that they have something to fall back on and that there's a heightened awareness of what's going on to offset that risk, having people standing by with the fire extinguishers. He also advocated for operators to have a good working relationship with the local fire department. Nobody likes regulatory oversight, But when something is going to be done, like a ceremonial cleansing or any kind of hot work, and I'm relating this as a former fire marshal and deputy chief, I want to know that that was going on. The knowledge could improve the effectiveness of a response to a fire and reduce the negative consequences. If you want to hear more about it, please go over to passionatworldtalkradio.com/blog. Read the article because this report contains additional advice. Why am I putting it, lest we forget historical? Because it's happened before and it's happened again. And most of these people are from the baby boomer generation. And those are the ones, your grandparents, who are most effective. So if you don't want to receive a phone call in the middle of the night telling you that the residence in which your folks are now living has a fire and they're probably burned, then you need to pay attention and work something out. I know in my senior community, we have fire drills at any time of the night or day. There's a regular spot where we need to meet, which is inside where the stairwell is. There are fire doors that close automatically, and a supervisor comes around to make sure everyone is out of their apartment by knocking on the doors or letting themselves in with the key. Let's face it, a lot of elder people and even younger people don't always wear their hearing aids, and therefore they will never hear the alarm or a doorbell or someone knocking. Something for all of you to think about. Thank you very much for joining us this afternoon. And this program is brought to you by Conscious Research Solutions. Check us out at passionatworldtalkradio.com/research made simple blog. Read all the pain points one encounters when doing research. And while you're there, please, if you have any research that you're considering or maybe in the future, sign up for a free 15-minute consultation and learn how you can either do research correctly or hire us to do it for you. There are 3 levels: basic, intermediate, and deep level research. And the other company is Ruby, RUBI.ai. Check us out here, http:// takes you over to a webpage where there are testimonials, a demonstration of Ruby, and then sign up for a monthly subscription. You'll need it. Your kids will learn it at school and how to use it properly, and so will you. A new flip book, Flipping Out How to Train Your Human, where AI herself, Artemisa of Justice, will tell you in very simple vocabulary and terms of how to use artificial intelligence without any problem. Remember, it does not do your thinking. It just tightens up, makes sure your grammar is correct, and you're using the right form of tense. And if you want to hear the truth, the whole truth, and nothing but the truth, go over to passionatworldtalkradio.com/donation and donate. Think of it as a GoFundMe account to help keep an all-woman-run own internet talk radio station on the air. We've been up for 19 years, and we plan to be up for another 19. Thank you very much, and have a great weekend.